This topic is a topic is becoming more dear to my heart, if you will, no pun intended, as I'm learning more about the importance of cardiovascular disease and soon approaching the #1 killer within the world. As we'll see in a minute on one of the slides, by 2020 they're expecting that this will be the #1 killer, and that women at this point are just over half of those deaths. So in my practice anyway, 80% of my practice are women, and as I've talked to other practitioners as well, in natural healing, that's the average. That's what I'm hearing most people say is about 80% are women. So the ability to see that there could be a problem with half of your patients possibly suffering from some form or another of cardiovascular disease, this is a large topic of concern and a great ability to understand more and have the ability to treat more people in your practice. So a wonderful picture of the heart and the vessels that support the heart, the great arteries, great veins of the heart supporting the rest of the system. This is me. I've been practicing 22 years now. And I'm going to jump off topic real quickly and just tell you a little experience I've had over the last 2 weeks of learning pain. On New Year's Eve, I hurt my shoulder practicing, adjusting patients, and I didn't realize, it was a little bit sore that evening, New Year's Eve. And New Year's Day, I could hardly move my arm, and I went and got an MRI and found that I have a slap tear, which means that the labrum that holds the humerus in place is torn on the superior aspect of that. And the MRI came back that it was torn, misshapen, and frayed. And the word frayed really concerned me, and I thought, well, I need to get over to see the orthopedist. So I saw Dr. Edwards today here in Bountiful, Utah, and he said, you know what, the thing that I want to let you know is that you're not going to be in a sling because we're not going to operate, because you might have a slight tear here, but you have frozen shoulder syndrome. Because I think you actually have maybe hurt your shoulder before as far as the tear, but that's not the issue. You actually have a frozen shoulder syndrome. So it's just been an amazing thing for me to feel pain. Never felt it before, and to be able to now understand more about what my patients are feeling. I just wanted to share that with you, that what a wonderful time, when he said we're not going to put you into a sling because we're not going to do an operation. This is not the issue. I says, if you're right here, Doc, I'll kiss your feet. So he put me on a Medrol pack, which is steroids 5, 3, 2, 1 over the next 5 days. Of course, I've had four steroids so far, but I've gotten 60% of my motion back just with steroids. But moving it through that range of motion is what's so important. I just wanted to share that off topic with you and know that that we don't always have to jump into surgery, that we can rehab things ourselves and understand that. So pretty neat. Okay, cardiovascular disease conventionally defines or refers to the narrowing or blocking of vessels that can lead to the heart, to a heart attack or stroke or loss of blood flow to any part of the body. We find that cardiovascular disease, when it's up into the brain, when you have narrowing and blocking of the brain, we now are referring to that, and I've heard out there, type 3 diabetes, or blocking of those small veins into the brain so that you're having dementia, Alzheimer's, so forth. That's just a blocking up of those veins. And I'll tell you later what happens when we use some of the most wonderful supplements ever created that we have the access to through Inno-Vita, that things can change with Alzheimer's and dementia and the brain disorders. But stroke, narrowing those down, having pieces of blockages come out from anywhere and getting stuck up in the brain, so now you've got an infarction of the brain tissue. So my expanded definition includes any critical problems affecting the heart, veins, arteries, lungs. That would be cardiovascular. Few statistics. Amazing. And this is what's just blowing my mind, and so much so that I'm just about to purchase a machine for about $5,000 that will show us extensively the cardiovascular overview and the autonomic stress within a patient. It shows about 10 different body markers. It reads it through an EKG, the different positionings, the different heights and widths of the OPQRS waves within the EKG. But amazing to understand that we can actually find out if there's a problem and show the patient there's a problem and give them a tremendous treatment. But to know, number one cause of death for both men and women, and by 2020 will be the number one death in the world, is what they're suggesting. In the U.S., claiming 1 million lives annually. This is amazing, equivalent to having September 9th on 2011 tragedy repeating every 24 hours, 365 days a year. I mean, we're appalled. We're blown. I mean, it was just such an appalling thing to have the towers come down. Of course, it was an attack. But here, that many people die every 24 hours is just amazing to me that we haven't jumped on this more. But we tell everybody, yeah, you need to get out and do your exercises, but there's more to it than that. Every 33 seconds, someone dies from cardiovascular disease in the U.S. Each year, more die of heart disease than AIDS and all cancers combined. Estimated by 2020, leading cause of death in the world. 80 million Americans have one or more types of cardiovascular disease. And 2008 total cost of cardiovascular disease estimated at $448 billion. Can you imagine? And here's the source here of these, so you can use these in your practice. Maybe make yourself something you can give to patients, or a wall plaque you could work with. Here's the prevalence per state. This is interesting. Down, in through the more fried food area, through the South. We do have a bit up through here as well, up into the Great Lake area. But just knowing that there is a correlation to inappropriate fats, the hydrogenated fats and so forth, that after we're cooking French fries and all those things. I think hurting my shoulder this last week has brought my physicalness, my physical body, to the forefront of my mind. I've always thought that I don't really need to worry. I'm going to be okay, and Heavenly Father's going to take care of me. I'm not going to ever get hurt, or I can go ahead and eat a diet that's not quite as good. I'll have some French fries occasionally, but why? Why do that? And if we can change ourselves and then work with changing our patients, giving them the opportunity to make those changes, it's an amazing thing. This is what is most concerning to me. Women account for just over half the total cardiovascular deaths, yet many women continue to think it's a man's disease. So if you look at this trend, here's the blue line. You can see that men's are trending down. Now this is only 2001. We couldn't find anything sooner than, or more recent than 2001, as we were studying and getting ready for the seminar. But just know that it's heading down in men and basically trending upwards in women. So this is something we need to tell our people here. And you can see the source here for this information. Okay, men and women are not the same with heart disease. Common symptoms may be different for them. So, women sometimes don't have the pain directly in the chest or down the left arm. They show other different situations, different symptoms. But when we start working, we're looking at angina. That's pain in the chest with exertion, shortness of breath, abnormal heartbeat. I found that this is an area in the SA node, the sinoatrial node. This is the pacemaker of the heart. That this area here is susceptible to different infections. Viruses, for example. Viruses can cause the bundle branch, or that main heart nerve, to not pass neurologic flow down to the ventricles and back and forth to the atria, causing the irregular heartbeat. So this is an area that can be affected by microparasite or by any layer of infection. But viruses are what I find a lot of times that's affecting the heart. Again, most of my practice I'm using kinesiology or muscle testing, or the EDS, as we'll see here in a minute, electrodermal screening. We can look for, and we'll talk about the different ways to diagnose. So pain, weakness, numbness, coldness in the hands or arms, neck, throat, jaw, or upper abdomen, and or back pain. So these are things we need to pay attention to as natural healers. Chiropractors, we're thinking, oh, you got mid-back pain. Well, let's adjust that mid-back. Well, yes, we want to do that, of course, but keep in mind that it could be a cardiovascular issue. So now how we diagnose here in my office, I use the electrodermal screening with the Asira. This is a really great technique. I find that it's able to show me radio frequencies of the patient, showing that if it's a virus or a parasite or any of the organ systems might be a problem. That's the Asira. Kinesiology, I think it's just vital. I just wish that medicine in general, whether it's alternative or if it's Western or Eastern or whatever, that we were able to understand and use kinesiology more effectively without fear of what the patient or others might think. A great book written by a medical doctor called Power versus Force explains the idea of kinesiology, how it's working with quantum physics and electricity and magnetics within our systems. Stress tests, we can send our patients up for EKG and cardiovascular, send them out to refer them out to the cardiologist. Stress testing, X-rays, checking to see the size of the heart. It should be less than a third of the size of the abdomen. Blood tests, now here we're looking for more insult where we're actually having enzymes, cardiac enzymes being released, but that's too far at that point. That's when you've had a heart attack or having one, those enzymes will be elevated. My personal clinical experience for 22 years now, I find that cardiovascular problems are often the result, again, of layers of infection, which can affect the heart, such as viruses, bacteria, and microparasites. Those are ones that I find mainly in my practice. You might find others, but so you've heard me to the last 7 or 8 seminars talking about layers of infection. Yes, I think layers of infection are one of the major parts, major issues I find, that when I take care of those layers of infection, and again, a layer of infection is maybe 5 or 10% count of what would normally be, let's say 100% count that we would find in a laboratory or up in the hospital. If you say, you've got a viral meningitis, which I find all the time, doesn't mean that they're going to be in the hospital with a massive outbreak, but maybe a little bit of a virus that's there, but the body's still on top of it. It's fighting it and knocking it down, but we can support the body's immune system by giving them various supplements that will support that immune system. An affected left side ventricle will cause the heart to enlarge as it tries to pump fluid throughout the system. So that's one thing we can look at with X-ray as well. Problems in the lungs, when we get issues where it's not perfusing through the lungs well, we'll get the right-sided heart. Our right ventricle will enlarge and stress the heart out as well. So layers of infection, if you haven't seen these before, I'll run through them briefly. Back to X for the bacterias. This is a great broad spectrum antibacterial. Very effective. Meta-X, it works with metals. Microsite is microparasite. So this is anything that you would need to see through microscopic. Paramac is for large parasites. Again, repassing how to treat these two. Microsite you treat for a minimum of 40 days. This usually the microparasites don't have larvae, and you can kill them with one 40-day dose. I usually find 2 to 4 a day. Paramac, this is where we're working on larval states. This is anything that you can see with your naked eye. So we do 10 days on and 5 days off. So 10 days on, we're killing the adult parasites. We let a 5-day rest period so that the larvae can hatch. To make sure there's no other larval hatchings, we follow that process, that 15-day cycle, for 4 cycles or a total of 2 months. We're working with the Paramac. Fungex is for fungus. I very much often use Fungex along with Meta-X. Again, the fungus will override and wrap around the metal so that the heavy metals don't cause damage to the host, that is the host for the fungus. This has an intelligence. Well, all of them have an intelligence except for the metal, but they're live, they're living organisms. So the fungus wants to protect the body from the metal. So that's why we use Fungex together, because as you're unwrapping or killing the fungus, now oftentimes the metal is there and can start to cause damage. So I like to use those two together. And lastly, ViroX is for retroviruses, RNA viruses, and DNA viruses. So these are our top layers of infection fighters. We also find that there's a kidney-heart connection. Modern science and ancient wisdom, the 5-element theory, recognize that the heart and the kidneys have a close relationship. This mutual dependence is often overlooked. So as the heart governs blood, the function of the kidney with fluids means that they rely on each other. So kidney problems or heart problems usually indicates an effect upon the other. So think about that. If you're familiar at all with the 5-element theory, Chinese acupuncture, that you can read in there and understand more of how those work together. So, oftentimes when I'm working with the cardiovascular issues, we will bring in kidney as well and support removing extra fluids if need be, balancing the overall water content of the body. So when I'm treating the overall treatment, we're going to use heart flow. Heart flow is designed to work with the muscle, the SA node, a V node, basically the tissues of the heart. Again, heart flow, as well as all the other organ system builders, have the ability to support and repair DNA function of that particular organ. So heart flow is very effective at that repair. Nervol works mainly with nerves and the nerve of the heart, the SA node and the bundle branch that support that normal conduction of the electrical impulse down the heart. Circulate works with circulation, all arteries and veins, circulation back even to the heart itself, with supplying blood to the heart muscle. And it's interesting as you first understand the heart and study it in medical school that the heart itself is a muscle, and you're thinking, well, it's got all that blood flowing through it. Why does it need its own supply? It's already got it all inside it. It's interesting to remember that you have to supply it on the outside, if you will. Kidney clear supports the kidney. This is where we're talking about. So kidney clear with the heart flow together, that works tremendously on supporting the overall fluid content. Permalung, because we want to, whenever we're thinking about congestive heart, that's going to be more lung issue. So we want to support, ventilate, get the respiration, remove gases through the heart, through the lungs. Just perfuse blood, and bring the oxygen into the blood. I'm going to leave Cardiar for the last. IntegraCell, these two here, I'm going to be taking for the rest of my life. Tremendous, out of the park hit with these two. IntegraCells are antioxidant. One scoop has 8,000 milligrams of type A antioxidant. Type A antioxidant is different than type B. Type B, one antioxidant of type B will knock out one free radical, where type A will knock out per milligram, so there's 8,000 milligrams per scoop. Each milligram will knock out 1,000,000 free radicals. So 8,000 milligrams times 1,000,000 is 80 billion free radicals that it knocks out per scoop. Nothing like it on the market. IntegraCell, we've done lots of work with it, checking to see the amount of free radicals in the urine, and IntegraCell just beats everything that I've seen. So when I'm thinking of cardiovascular, we want to get rid of those free radicals. We want to get rid of dropping the acidity levels. One thing I didn't talk about yet is the acidity level. We know that we shouldn't eat fats, hydrogenated fats, and we should eat more omega-3 and omega-6 fatty acids and get our good exercise and have digestive enzymes. But we haven't talked about the amount of acidity that people get from fear, worry, and eating too much protein. There's a lot of research out there now that shows there's more correlation to, instead of high cholesterol, it's correlating more to high stress and the inability to let go of the stress and have your body be in a non-stress state. Even if you are in a stressed job, you can do a 5-minute, 3 to 5 times a day for 3 to 5 minutes, a shutdown, where you just sit down, shut your eyes, don't go to sleep if necessarily, but shut down and let the backpack of stress come off of you. Even if I was to be teaching a large seminar in front of millions of people, I could sit down and have a power down just before I go on stage. You can do that in your practices. If you're going to give a talk in church or whatever stress there is, you can power down just a bit. So that's a very important aspect of getting rid of the acidity, getting rid of that acidic level. Of course, dropping our cholesterol, as we want to do that because that works with plaquing. So now what I'm going to talk about is Cardiar. If you're not familiar with Cardiar, you need to get very familiar. 1998 Nobel Peace Prize winner for health was the idea and research in showing that there's a way to increase the nitric oxide within our cells, or produced by the cells of the arteries and veins. Within the arteries and veins, it has the ability to create nitric, not nitrous, but nitric oxide. Nitric oxide is what creates the pliability and elasticity of the arteries and veins. So the Nobel Peace Prize was that 5,000 milligrams of L-arginine would support and be the precursor for those cells of the epithelial wall of the arteries to create nitric oxide. Nitric oxide, however, has a half-life of 2 seconds. The second thing they found was that L-citrulline at a dose of 1,000 milligrams would elongate the half-life from 2 seconds out to 24 hours. So taking Cardiar with 5,000 of L-arginine and 1,000 of L-citrulline increases that nitric oxide. Nitric oxide's benefit: elasticity of the arteries, smoothing of the arteries, so there's less chance for plaquing and creation of blockages, and also it helps drop cholesterol as well. Cardiar, when taken from a dose anywhere from 1 scoop a day to 3 to 4 scoops a day, can perfuse and revigorate, re-youthfulize. Oh, that's a great word. Re-youthfulize. I just created that word. I'll have to put that in the dictionary. And reverse cardiovascular issues. So what I was going to tell you before, one of our practitioners had been using, one of his patients was in the care center with dementia, hadn't talked for 10 years. And they were feeding him 3 scoops, I believe, of this, not particularly Cardiar, but the same idea. It was another supplement, but the same 5,000, 1,000. And over a 3 to 4 month period, he became more lucid, and one day turned to his daughter, having not seen and talked with him for 10 years. He looked at his daughter and said, "How have you been? I haven't talked with you for a long time." And that's the last I'd heard. I haven't kept up with that story, that case study, to see how things went there. But the idea of perfusing more blood to all parts of the body, specifically the brain, and to the more smaller periphery, into our hands, feet. Think about how this affects our diabetic patients, being able to dilate those arteries and arterioles and venules down into the feet and the hands for peripheral vascular diabetic neuropathy, eyes when they start to go blind from it. So this is a tremendous supplement to work not only with cardiovascular, but with the diabetes as well. Now, if you look, also Cardiar has form code. So form code for heart is the genetic repair process that's in each of the organ supplements. So, for example, Permalung, Kidney Clear, Circulate, Heart Nervol, Heart Flow. Each one of these has form code. So whenever you see form code on the list of ingredients, that is created DNA form for that particular organ. So Cardiar has heart form code, amongst other things. So you say, well, gosh, I can get this 5,000, 1,000 mixture anywhere. I can go to the health food store. Well, yeah, this is less expensive, much, much more per scoop, and has the form code in it to support those organs that we're after, which would be basically the lung and the circulation and the heart. So you cannot beat the Cardiar. So you put Cardiar with IntegraCell, bam, bam. That's what I'm talking about. And that's where I'm going to go, because I plan to live for a whole long time. I'm not going to have none of this torn shoulder stuff. So treatment, heart flow, roughly, and I'm always going to suggest that you check kinesiologically to find out how much your patient should have. If you don't know kinesiology, talk to Inno-Vita, and they'll get you a very easy kinesiology video that we created that will help you, complimentary. This will help you to understand how to check. Don't just go by weight, or don't go by just what you happen to feel. It's very important to check muscle testing to find out how. But you can look along here and see these. Roughly, I do 1-4 times a day of most supplements that I give. So there you go. I love it. I think that we have a great chance to make a major influence into the health of a lot of people using these supplements and this information. I hope this has been beneficial for you. I'm not sure. I guess it would be the L-arginine that would be the issue. So I would try doing much, much less. See if you can, instead of doing a scoop, try very slowly and come aboard slowly. So I'm wondering if it's, I'd have to look that up more. But I think it is the arginine that's doing that. And I'm not sure exactly the correlation there. But I'm wondering if that's bringing that herpes out, then we need to then jump on, and I'm sure you've treated your herpes a lot, but think about possibilities of using the ViroX for it. You've probably already done that, but think about using ViroX and treat the herpes. get that out of there so that it doesn't. The effect of the Cardiar is so beneficial for you that I would suggest taking some time if you need to and get that herpes out of there. Virox would be good. I think that Des Bio here in Salt Lake carries a herpes series therapy that would be beneficial in a 1-2 punch with Virox. You could also figure out and talk around and see if there's anything topical that you might put on that as well. That's what comes to my mind. You could also think of Smart Silver. That's also Smart Silver is at Des Bio. Bionativus out of Ogden as well. I know if you called Inno-Vita, they'd give you Bionativus' number. One thing I like about Inno-Vita, they're open to share, and they realize that they're not the end all. So it's they're the 95% all, but we do need 5% of other things to help. So I hope that helps. That's what I would suggest as well. And that was the one I couldn't come up with. L-lysine that's when you want to work on with the herpes. But I sure would not throw the baby out with the bathwater on this one. And don't not take it. I would just go intensely after knocking that herpes out of there and making sure that then you can handle more, more of the Cardiar. I would, again, kinesiologically check yourself to make sure that that's appropriate for you, because sometimes when we're in there cleaning and clearing and cleansing, we can create a Herxheimer's, but Herxheimer's is a big word, and people say, well, I'm herxing, and there's all kinds of acronyms and things, but a flash flood is what comes to my mind. Can you see a rain cleansing up the valley somewhere, and now you've got a flash flood coming out into the valley? I think that we need to be careful. I, too, use that. I'll do a scoop of IntegraCell and Cardiar and Leptera and my green smoothie. Now, I'll tell you what, I hardly even touch the ground as I'm walking with it. Just make sure that you're able to handle the goodness that you're putting in, because oftentimes we've got to pull the bad out. You put good in, bad's going to come out until you can equalize that, until you have a lot of just good. But to try it, I would just first off, I would take them separate and just find out what's best for you, which one is best in the morning. And if you wanted to do one in the morning, one in the evening to start out, but just check yourself. How much can I take here? I've got some patients that can only take a little bit, just as they're working through, like the size of a toothpick. They're starting out very, very small and slowly adding up to where they're taking full doses.